Now there are several kinds of pharmaceutical drugs that you can use for type 2 diabetes. The first, a group of drugs that work actually on your liver. We think about the liver as a blood filtering organ and now as a cholesterol making organ. But the third thing about the liver is that it is also a sugar secreting organ. We've heard about these marathon runners that get together for parties before a big race and they all eat a bunch of pasta. And the whole theory behind that, I don't think that really works, but the whole theory behind it, besides camaraderie, is to load the liver with glycogen. The liver breaks the glycogen down into glucose and releases it when the liver senses that you are under some sort of stress. The liver doesn't necessarily understand the difference between a tiger and an angry boss and an inflammatory process going inside of you. All it knows is that there are hormone messages suggesting an alarm bell has gotten rung. And so it breaks down glycogen and releases it as sugar. Metformin, or glucophage, is a drug which acts upon the liver to say, you know what? You need to stay out of this conversation. Just keep your sugar where it is. And then the patient is supposedly freed up to manage their glucose levels with their diet and conservative ways of eating and so on. The problem is that there can be enormous side effects with this medicine, not the least of which is, of course, directly on the liver, but many patients also experience nausea, vomiting, stomach aches, belly pain, and so on. Other diabetes medicines increase the sensitivity of the insulin receptor, but those have even greater side effects, such as problems with muscle wasting and fatigue and nausea, headache, rashes, a number of problems.